Alright, this will be a very unconventional demonstration of polishing because I don't have a patient here at this hour at the office. So we can demonstrate on patients at a later date. I was just going to give some tips here on technique, and it will be a little bit easier to see because there's no lips or cheeks involved on the model. But one of the things I wanted to say, I put my safety glasses on. I encourage you guys use those. I think we have enough around the office. Put that on the patient if they have contacts. Or just the regular eyes. You don't want to get this gritty prophy paste in there. That would be probably the worst thing around the office. So, want to stress that. We have the two flavors, as I'm sure you're aware. We kind of cut down from having a bunch. We have the mint and we have the strawberry, and we went with coarse. We've had every kind of fine and medium, but coarse is pretty good overall. We don't do it often enough to really damage the enamel with any extra coarseness. If they have veneers, you want to use the Super Smile. I'm sure many of you have been shown. Just get out just a single prophy cups. I don't have one out here right now, but you'll just squirt a small amount of that. So that has no grit. So there are special circumstances, but coarse for everyone. Let them pick a flavor. If they have a lot of stain, we have extra coarse. We only have that mint. It only comes in mint. So there will be times, I know I've helped many of you I said they have heavy stain, use extra coarse, and you just kind of skip that questioning of which flavor would you like. Now, here's what many of you are not going to be real excited to hear, but we've done this for too long. We're just kind of substandard on our polishing, and we really need to improve. So one of the things that I walked into dental hygiene school, and they said, forget everything you've ever done, anything you've been told, and all techniques you have had. And it was a little harsh, but that's about how we are going to have to operate here at Smile Dental now with our team. We want to be as excellent as we can with patient care. And I know hardly any of you are actually using the prophy cups, the polishing cups. We have the metal ones as well. Should have had that out to show you. We have the little rings. So it's kind of a preference. We can get some of these in the blue style. That's my favorite. A little bit easier to use. But again, if you're a right-handed operator, you're going to do that on your left hand. Put it probably between your third and fourth finger because you can just hold on to it better. Takes some getting used to. I know probably everybody around the office says, I don't use that. Well, it's actually being lazy, not using it. Sorry to put it bluntly, but the doctors and I were talking about it, and we just need to improve. The reason you need to use this is it's easy access. You'll be getting your prophy paste every 2 to 3 teeth very, very quickly. You don't have to reach over here. You don't have to grab that. And the main reason is because you need to be using a mirror. I know you may think, I never touch a mirror, but we are going to have to make some changes on that here at the office. You need to learn how to hold the mirror, pretty much like that. Use it in there. You can play with it all the time at home. Roll pins between your fingers. I know that Anna and Shannon may be left-handed, so I mean you're just going to adapt that to the other side, just like any other instrument. Hold it with your first finger and your thumb, and kind of brace it with your third finger. This fourth finger is always your fulcrum ring finger, so whether you're holding a mirror, instrument, anything, you need that against something solid, such as their teeth. Sometimes their chin, you know, you can use that with a mirror. It's not a sharp instrument. So that's what we have to improve on, is the main goal with this statement. So again, you can't be using a mirror and polishing and being efficient unless you have something holding your prophy paste. So let's just assume that this patient here, Mr. Typodont, as he's well known, is going to want mint, so I'm just going to pull that out. Don't be afraid to use this. I feel like you guys are just using a very small amount. Use your prophy paste. You can only do 2 to 3 teeth at a time without loading that up again. So I'm going to just kind of demonstrate there. Go very light pressure on your rheostat. I let that kind of fill up at first before I ever start, and then you've got a pretty full cup. So you want to have at least, you know, level, and then start out, and then you're just going to add small amounts each time that you keep losing. So we'll have to clean this guy off. I don't have a mask on. Obviously, you would always have a mask, but I'm demonstrating on the video. So as you go in, with kids, you would always want to start on the facial because it may be the first time they've had that, maybe a little invasive, maybe kind of gaggy. But you always just want to maybe show them on their finger before you fill it with prophy paste what that feels like, kind of tickles, call it Mr. Tickle. But you would start in the front. Now for all others, because I know you may already have your technique or you may be starting from the other side, operator, but really you need to just kind of follow. What we were taught was starting with number 1 to 16 and going back, and kind of similar on the lower. I think we actually started over on the left side and came back, so you just follow a pattern. That's not real crucial, except that doing it that way ensures you get everything. So again, you just want to probably go in the mouth, start here in the back, kind of start on the distal, if that makes sense, then the facial, then the mesial. It's always a 3-point thing. With these rotating back and forth, there's not much of a risk of the friction, but you really do want to get those angles, and the only way I know how is with that fulcruming finger. You can put the pressure, you can do the distal, you can do the facial, you can do the mesial, and I would have to, at that point, I've lost a lot of the propofol paste, so you've got to fill that back up. Again, same way there. You don't want to put a lot of pressure on their gums, but you want it to flare underneath the gum comfortably. So you got all that plaque out from under it. And then you're going to just continue the same technique, fill your propofol paste. Normally I could have my hand, right here on facial, so it's not a far reach. Come around the same way. Now, sometimes you have to kind of work your way down. You probably have your fulcrum finger here. Use a sweeping motion. Go across the facial. If it's stained, you may spend quite a bit of time. Now, do not apply pressure and keep it on there. This is what heats it up. Way too much friction. You're doing this, trying to get stain off there. That's incorrect technique. It's very poor operating. You're just going to heat up that spot. You want to just keep going around it, keep going over it. You can go over the same tooth many times, over and over. Sometimes I just have a little staining there on the mesial, and I'll kind of go back over about like that. I'm sure you've seen the doctors use the different polishing devices for the cosmetics, and again, they don't just stay on one spot. Sometimes I get a little lazy and I keep my foot from, used to when I first learned, I just did this. Stop, stop, stop. That's fine and for learning, but again, it almost goes too fast. So I get kind of lazy. I might keep it going, but I'm still doing a 3-point technique. The instrument is only on the tooth at about 3 points, so that's something huge to remember. I don't just get lazy and leave it on here the whole time and do that, because that's just poor technique. So again, you're going to just follow the whole thing all the way across, and then I would rinse. I wouldn't go any longer than that, possibly halfway through. Again, it's gritty. Most people don't like the paste. You want to make it as pleasant as possible, so rinse them out. I'm not going to do that here on the type it on, but this is the point where I would start using that mirror. Is generally have them away from you on this side. Again, this is right-handed operators. As you're going here and you may think, well, I can't quite see, try not to bend way over or do any crazy things. Just have them turn towards you to where you can see that. You should be able to do the facials fine there. Maybe use your mirror for a little bit of retraction. But as they open and you're going to do the lingual after you've rinsed, this is where you cannot see the lingual of the upper right. So that's where you have to actually use your mirror and go along those. So it's the exact same technique. I'll just let his lower jaw drop off here. It's not a conventional patient, so it's a little hard to use. But I would just be looking through the mirror and going on the same kind of technique all the way along there. Now this is what I see everybody missing. This has been true the last 6 years working with assistants, is for some reason after even the occlusal paper's been used, you guys said, well, I polished and there's all kinds of marks on here, so I know you're not getting occlusal or not as well as we should, possibly just not using the mirror, not seeing that on the inside. But you do want to go ahead and polish these occlusals. That's where they're getting most of the plaque, most of the cavities developed in the grooves. We're doing most all of our fissurotomies in those grooves, so make sure you spend a little extra time. I usually do this section, I'll do right along the gum line, do the whole lingual, and then I'm on the occlusal. Obviously these only have kind of a incisal edge, so you're just going to do the lingual there, just same technique, and they might be able to turn away from you, and then you can see that. Again, you don't have to really use your mirror anywhere you can see, but you at least want to be checking after you've rinsed, did I get everything? Is anything remaining with that mirror? I don't see you guys doing that, and we've just got to change that. So try to kind of elevate yourself, be the best assistant you can. You want to make sure, before I've even gotten in there with the doctor, that, hey, it looks clean, no plaque. Obviously, you're not going to get off all the calculus, if we haven't scaled yet, all the staining, that just won't come off work for a while on it, sometimes getting the pumice, doing something like that. But rinse after you've done the uppers. And then the best technique on the lowers, again, I'm sure Dr. Fuchsia said this many times, walk your hand up along the saliva ejector and make yourself a little candy cane. That'll hang about right for what you need, and it avoids kinking it and stopping the flow. Do that, hang it on the side of the mouth when you're doing the lowers. I do that about right in there. That way it's catching it. They start tasting this. And I only do half of the mouth. This was a huge technique. We went to some learning things. Andy RDH, all these big websites have the best, fastest technique for polishing is to place that in the mouth, and you're going to move that right now because I can't hold on to it. But you would have the saliva ejector in there. You can have your mirror and everything, but do possibly the facials up to about the midpoint. Might need to rinse then. If people are really salivating, they just kind of need to rinse, it's kind of gaggy, you can rinse that point. What I have found to be true is just I do that whole facial, and I won't bore you with that right now. And then while they're at that side and I use my mirror, I can pull the tongue back gently, probably just kind of retraction there. I go along that lingual side. Don't see you guys always getting quite at this angle, because they always have plaque there along that lingual edge on the inside. You can be very gentle. Just kind of move it out of the way with your tongue. You can kind of depress that on the tongue. Try not to gag them. Do your occlusals on that side too, but I always usually check with that. If they can lower their chin down, you can kind of get the angle. You don't always have to use a mirror, but usually I have to kind of use that for the front just to make sure we're getting every angle. But I would rinse at that point. Don't go any longer than doing kind of one side on their lower. And these are just ways to make yourself the best assistant. And the patients will love it. They won't say, oh, I hate that polishing, and I always am choking on it. And then just follow it one more time. So again, you don't have to follow the exact pattern. I'm just giving you kind of a general. That's a great technique. And then I usually just come right back around. I do this side, move that saliva ejector for them. As soon as you're doing the right side, I just do the lower right and rinse them off. And it doesn't have to take long, actually, at all. You can do that very, very efficiently, very quickly. But you want to be thorough. I'm looking for efficient, but all the times I have to go back and check that again, do it, and it's fine. I want you guys to leave the prophy angle out, leave floss out, leave things out. Like if I'm going to see the patient again, possibly the doctor is probably not going to pick up the prophy angle again, but if there's something remaining, we want to be able to clean that off. And if there's a lot of calculus, there's going to be a whole new surface we've uncovered. So sometimes I just polish the lingual of the lowers after we've scaled. So don't feel like that's a negative thing on your end. You may have polished and thought, oh, I thought I got everything. That has nothing to do with what you got. Probably were thorough. We just uncovered a new area. So always leave that out. But that is the best technique there for doing a very thorough job on polishing. So I'll give you a few tips. Hopefully you can see that a little bit better, but you want to be slow and gentle with patients, but not doing a poor job where you've only actually gotten half of it because you couldn't see. I can't see. I could not do scaling without a mirror, and it was a hard thing for me to learn. Took weeks, actually, of getting used to it, but they said, you can't just do the places you can see or what you feel like you can see because you'll miss about half of that. So that's what we've got to kind of elevate our polishing to that.